Well, this is a very Herculean task which Sandeep has taken. It's a long course for 7 days altogether. And well, it will be a benefit for all the DNB, MD candidates who are just nearing their examination. Well, for the next half an hour or so, we will see that the culmination of what all you have actually learned in the 3 years that actually results in the you getting degree or diploma or whatever. Because we have been involved in these examinations for a long time now, we slightly know means what are the problems. And as you can see, the title is Writing Theory, though the title which is written in the program is How to Appear in Theory Exam. Well, in the lighter vein, I must say, you have to appear in person. And for practical also, you have to appear in person. But actually, it is how to write theory and how to present a case. So that's why I have built it a kind of inspirational talk, so that you just get some tips and bits from me, what actually examiners need and how you are going to impress them and how you are going to fetch more marks, because that is what is required out of it. And in fact, since NEET has started, the examination with which you enter in any of the courses, well, they are all multiple choice questions. So what has happened that they have increased your area, means the knowledge base has increased, because then only you can answer those questions. But what has happened is that how, after learning a lot, how to actually write it down so that the examiner understands what is running in your mind and how you are actually expressing what you have learned. So that lacuna is there. The same thing is everybody is so much engrossed in SMSing things, you know. Two friends might be talking to each other only through SMS and also emojis. Now, well, still we don't have emojis depicting so many medical terms, right, accurately, so that we can use it. So still we are far from that. So we have to write it down. That is what theory is. And presenting cases means you have to really look into the eyes of the examiner, and he understands by your demeanor whether you know the case or not. So small information I'll give you as we just go through this talk. So before that, because it is zooming on and it is on the social media as well, so I must say that the photographs and visuals used in this presentation, they are not by me. They are only for emphasizing the points teaching by the speaker, means me. The whole format and idea of presentation is mine. Well, there are no financial implications involved in this presentation. And also, I do not permit the recording and replaying of this presentation after the meeting on any platform or social media. Well, I think all of you must have, all these students must have born after 1979. But in that year, you know, there was a big singer, Pink Floyd. He came out with a wonderful song. And that started with, we don't need now education. You see, you can straight away jump on it that, well, he says no education. So it's a very broad definition of education. What is actually education? It's only rote learning and cramming and writing, or understanding and have your own views. Actually, the gist of the song was that. And I like this song very much, right? It would give you thoughts to understand. And that is what's needed when you get trained by the side of the patient throughout for 3 years. And what else you need? You need a mentor. Means there has to be somebody who takes you in this course of 3 years down the line, so that he makes you to look beyond his shoulders. That is what's the meaning of mentor. Just imagine a child sitting on the shoulder of his father or
देखिए
mother.
आ गया
He actually looks beyond what the parents have seen. So what you need is actually a mentor, a good mentor. And you are lucky if you get a good mentor, you see, because you see this in this picture, the boy who's making this boy pee, he is actually the mentor, right? He has created a space for this person to work actually. So that is what a mentor is. Means he is there, but he is not there. That is the best mentor. So mentoring is very important. So always listen to your mentors. And what is there? I talked about knowledge. Knowledge is important. It is the power. You have to gather that knowledge throughout 3 years. Then ultimately you can succeed in writing in the exam or facing the examiner. So by any means, it's not like that. You just don't do anything throughout the 3 years, and ultimately at the end of the 3 years, you think that, well, you should pass in the exam. Let me tell you, boys and girls, no examiner intends that any of the students fails. Why? The reason is that in medical profession, examination is every day. You are facing a patient, that is the real examination. You are just preparing yourself for that. He'll be the ultimate person to test you on day-to-day basis. So knowledge is very important. Always remember, from the day one you have entered the course, you start gathering the knowledge. Read like anything. Learn as if you are going to live forever, as Mahatma Gandhi has said. And one more thing, I like this Hollywood hero, Johnny Depp, too much, because he has done lots of difficult characters. And when somebody asks him about the 4 questions of value in life, he only said that, well, you love whatever you do. So if you have joined the course, you love that. You love reading. You love to look at the patients. And once you get that connect, then actually you start reading about it. Do lots of collateral reading. Gather education, and that will help you throughout the life. It is not only a 3-hour writing the exam. You have been through the exam for the last 3 years, and now the time has come only to test it. And confidence building is very important. Once you have gathered that knowledge, once you have interacted with your mentor, then you will find that, well, the confidence has come in. It comes slowly, right? So that is important. Whatever you do, confidence building is very important. And one more thing which I always tell my students is diversified reading. See, let me tell you again, let me reiterate. Anesthesiology is a very difficult branch. In fact, I find it to be the most difficult in all the branches available in the medicine. And irony is that even a bit of it is not taught during the undergraduation. You suddenly end up or appear for your post-graduation in anesthesiology. And sometimes I find that anesthesiology doesn't have any boundaries. It is a boundaryless branch, You have to master of pharmacology, anatomy, physiology, right? The drug interaction, the toxicology, the allergies, their management, resuscitation, its management, and anything and any time. You look at this COVID period, who were in the maximum demand? The anesthesiologists. Because these guys, if you must have heard that English language, the jack of all trades, master of none. Actually, anesthesiologists proved to be a master of everything. And he works with economists. And so how you can become a master of everything? That is by collateral reading. You're a master of ECG, learn ECG, like a cardiologist do. So that is what's important. So we have gathered knowledge. 3 years we gathered experience. This is the gist of my talk, if in a way I can say. That ultimately what happens, this knowledge and experience, you put it in a hopper. That is the examination mill. And it works for 3 hours. Multiplied by 2, 3, 4 days, whatever, how many papers you have got. And then it will end into, the end product will be either a degree or diploma. So in the hopper goes your knowledge and experience which you have gathered, right? So that is there, that's very important. But because it is a machinery, this examination bill is a machinery, so it works on its own principles. And this process, the way this mill works, depends on 2 very important parameters. One is the memory, means your memory has to be very strong, especially in medical science, because you have to learn so many things, right? They have to be on your fingertips, right? So that is very important. So if you keep on working, day-to-day practice, if you are learning every day something about, then this onslaught on your memory bank inside the brain, right? It starts working. It is there to work. Only you have to make it work. As much as data, you put in and take it out, put in and take it out, the things will become easier. Your memory will get sharpened. And the other thing is, the way you answer means how you make this mill run, the exam mill, right? So that we will see it now. Always remember that mock practices are very important. Means you learn a lot. You gathered a lot of it, lots of education, lots of collateral reading. But if you don't know how to put it in a nutshell so that the examiner is able to understand, right? As if you are playing here and there, but you are not just hitting the bull's eye. So your hard work can become counterproductive throughout 3 years in a short span of few days and hours, what you call as the examination. So keep on practicing. Even still, if you have a 1 week, after that means before you go to the exam, do some mock practices. 4 or 5 people sit down together, fire questions to each other. All right, it will help you out. So at the outset, when you go for theory, first of all, read all the questions. Look at the format of questions. Supposing there are 10 questions, look at the format. Those will be different. And immediately allot the time for each question, right? Time management is very crucial. You don't want to write a lot on one and miss 4 or 5 others, because then your sloppiness will be visible to the examiner. And whenever you are answering a question, because in our science, medical science, it's a big gray areas. Means we can never be absolute right. So there are always pros and cons. So in your argument, when you write the examination, your papers, your questions, you have to have certain cons also. That everything is not good. You're describing an instrument, well, it has its own problems also. That shows that, yes, at least you will not do harm by using that. You know when to use it, when not to use it. in medical science, as we age, the aging brings in what is actually not to be done. That is important. And always assign some time at the end of 3 hours so that you can just review your questions. The other very important thing is, because we keep on seeing all the times how the answers come up in the question answer books, the best answers are which are structured. Means you begin with some introduction to the question and the main body of 2 or 3 or 4 exact paragraphs, and then you conclude it. It's very important. If your structured thing is there, it really makes your question good to look at, to read it, and also to mark it. And whenever you are reading your questions, keep a pen in your hand. Always remember that human brain, whatever activity it does, if that activity goes along with some somatic activity as well, means you are doing something. Like, people develop certain kind of tics. Means they are either shaking hands or something like that. Actually, this is a kind of coupling between what's in the brain and how it is coming out, right? And that tic is actually helping out to draw that information. So if you've got a pen on the hand, then your brain immediately understands that you are serious. And it will do, because you can mark on the questions, and also you can mark something somewhere else as well. That I'll show you just now. And this is one of the most important thing for me. I always explain people that don't actually, the red light and the green light, these are they are not the smart lights. They are simple, straightforward information. Red, stop. Green, move. But the most important one is the middle one, the amber light, the yellow light. Why? Because then that is there, you have to pause and think of the next action. So this light should work always in your mind. When you are reading a question, just pause for a few seconds. Gather yourself up. Gather your information. Draw it from your inner memory banks of the brain with a pen in the hand, so that you are able to answer it properly. The other thing, if you've got a pen in the hand, then immediately you are reading the question, identify, underline the important words in the question that needs to be answered. Like I have written a question here: how mixed venous oxygen assessment can help in goal-directed therapy in intensive care unit. Something to do with hemodynamics, how you want to actually potentiate it so that the patient doesn't get problems. So you underline mixed venous oxygen assessment. You have to write something about it. And also to the goal-directed therapy. And then you have to build up a link between them. That is how you prepare before answering. And always remember, I have seen people just forget the context somewhere when they are answering the question. So context is very important. Value of X can be anything, but we have to understand that in the question, what it means. Right? Sometimes people just don't understand and they write here and there, but they don't home in to the real answer. So understanding of context is very important. And always remember that when you open up, when you start answering, like the previous question which I showed, right? Then you actually start with mixed venous oxygen assessment. What happens? It is a kind of introduction that how this acts. What actually is this assessment? What it is telling you? What is the context with the goal direction in a patient who's very sick in intensive care unit? So that has to come up. Again, a very important slide. Let me again tell you, do you know how long it takes an experienced examiner to look at your paper and mark it for 1 or 2 minutes? Just take my words. It's not more than 5 or 6 minutes. You can say, oh, is it so? Yes, he only looks at the intro. Like if you know an English word, supposing, right? Beautiful. Your mind doesn't read the whole word as beautiful. It will just lift 1 or 2 words or letters in the beginning, BE. We'll look at the length of the word and how it ends. That's it. That much information is needed to build up the picture of beautiful. The same thing is here. If I read the intro, if I read the conclusion of your answer, I know what you mean. My experience immediately gauges you what you have done. Just I will try to find few important salient points in the main body of the answer, and that's it. That decides beyond 50% or less than 50%. The body must have 2 to 3 or 4 paragraphs according to the content of the question, and always take means these kind of words, which actually tells you that you mean your business. And conclusion is also very important. Finish off with a paragraph, like just you are summing up. So you sum up with whatever it was in the beginning, how it ended on, and ultimately what was your conclusion. So you can actually do that. That goal-directed therapy must target this much of mixed venous oxygenation, and you can build up a decision tree on the basis of that. And you can have other parameters that has to be actually looked into and changed so that you can attain what you actually needed. Now, just to give you another question, which we placed recently in our mock-up exams. It's a very recent phenomenon that's occurring. What's the mechanism of hypoxia and COVID-19 disease? See, 4 months. Discuss the oxygen therapy in these patients, 6 months. So it means the examiner wants you have to be very elaborate in oxygen therapy. But if you are just accurate with the mechanism of hypoxia, that is there. You don't want to be very exact, put up all the description and all that. And many people try to do that. And what happened? They forgot oxygenation therapy. They only just mentioned 1 or 2 lines. So that actually tipped the scale of balance, and you may lose marks. So draw some figures. For second part, give everything. Oxygenation algorithm from simple to complex. Don't forget ECMO. It has been used. Don't forget lung transplantation. It has been done. And do not forget to write other therapies along with oxygen therapy, whatever the existing ICMR guidelines are there. And in conclusion, oxygen therapy, home or hospital, monitoring by pulse oximetry, all these things, it goes in. That's it. We will be happy. So that is how to answer the question. And few nuances. Well, always try to be simple. But it should not be so simple that you forget and lose the context, as the boy Peter lost it here. Your education, the way you learn how to answer the question, will take away the self-doubt because it creeps in very fast. when you are sitting on an examination. There may be some thought blocks as well. But let me give you a tip, because thought block can occur at any point of time. You may get stuck up at any question. So, but you know, you have already read the question paper in the beginning, so your mind starts working on that. You might be answering goal-directed therapy with mixed oxygen saturation, but you have also read the COVID. So your mind suddenly, few points for that question flashes in. Now, always remember these flashes. Keep a tag of them, right? If they suddenly come into your mind, you immediately on the back of your answer sheet, you put question number this and those points, because you may forget them again. So you have got good points on which to elaborate. That's the best way to actually take care of thought blocks. It's a common thing, you know, it happens to anybody. 20 years back means I was speaking on some platform and suddenly I had a thought block. Means I have to stop, take some water in, and then I have to begin with a different way to tackle that problem. So it happens. Don't fear it. And another very important thing is try to attempt question in that order as given in the question paper. Because the examiners, because they don't like this to turn your papers too often, back and forth, and then they will say, oh, this person has done what? So try to do that. And also, don't try to be over-ambitious, that you know a lot about something and you write a lot on that. What's the fun? You may commit mistake, you know. The straight answers, give a straight answer, that's it. And always remember, when you write, leave the margins. On the left side, there will be a margin, but on the right also leave a margin. Leave a margin at the bottom of the page as well. Don't write up to the last, means where the page ends and the table begins. Don't go up to that point. Stay around 1 inch above. You may have many copies because it is like a framing of your question. It makes it more beautiful. And then handwriting. See, when I was a consultant in United Kingdom, one of my ODAs, you know, when I used to write, he used to shake the paper like this. I said, what are you doing? He said, trying to understand what you have written, Prabhat. Why? This is a doctor's handwriting, you see. You have to shake it up, then it will form the words. Well, that is how handwriting evolves, you know, in the medical profession. Because we are too much procedure-oriented, looking at the patient and all that, right? So somehow handwriting takes a back seat. We are not a kind of a person who's living by the writing. But those who have good handwriting, right, which is at least you can read it properly, they always get 1 or 2 extra marks. Always remember that. So whenever you are writing, make small sentences, full stops, commas, they are important. Use bullets. Bulleted text always looks good, and it also shows that you are not cluttered and you know what you are doing, right? And always remember, important point, important diagnosis, which is most common, right? That must come as a first place. And avoid writing controversial things, because you are only appearing in an exam for MD. You are not writing a paper for Lancet. So don't give too much of controversial points, right? So you are just wasting your time. Only 1 or 2 concepts per paragraph, not too many lines in a paragraph, and don't try to beautify what you have written. A good handwriting with bullets and few colors, that is enough. Avoid too many underlines. I got once to see one paper, right? And where every means, I think I could count words that were without underline. The rest was all underlined. So what's the fun? You have lost actually giving into what is important because everything is underlined. And don't use more than 3 colors in a page. More colors, oh, don't try to build a peacock or a rainbow. No, rainbow looks good in the sky, not on the paper. And also be consistent in the use of colors. Means, supposing if you are putting your headline with red color, then use the same color palette, Don't try to change it too often. It becomes irritating. And one more very important thing you see in medical science, because we use so many abbreviations. So always use universal abbreviations. Don't create your own abbreviations. Very important. Because then you have not given a key of your own abbreviations anywhere on that paper sheet. So why you want the examiner to really rake his brain, go to the Google and find no answer? Here's what this guy has done. Nah. So you have to build up your impression. And also because you will find the questions have guidelines embedded in them. You look at them, define, describe, discuss. You should know how to answer that. And medical science also use appropriate diagrams, flowcharts, table, illustrations, because picture can give you, means it can give information what the words can't, right? So that is important. Like a nurse in Sri Lanka, one of the hospitals I visited, you see, I saw their NPO, the way they explained, and when they told us that, look here, when we started drawing these kind of pictures, the compliance was 100%. So that's the power of picture. So quickly we go to the practical examples, case presentations you will have. So that was theory. Nowadays, theory also means you have to pass your theory. So these are few things if you take care of, you will be able to answer well and score more than 50% marks. That's what's required. Now to the practical examination for 5-10 minutes. The difference between practical exam and the theory exam is that in theory exam, you need to give your lots of information, right? And the information that is there, like ECMO, you may not be using it, or you may not be able to use it in your lifetime. But if you give that information, it actually, you may get more marks. But in practical examination, it's just the reverse. You don't tell ECMO or something like that. But if you falter in oxygen therapy with mask, with nasal cannula, how much you are going to get it, means the basics, then it will be a real hard walk for you through the practical exam, you see, because that is the difference. Means the basics you have to know. You may falter in something which is really difficult or it's a recent advance or whatever. No. That is the difference. You get a long case and the short cases. Long cases means the history and everything is more important. In short cases, it usually begins with the diagnosis, right? And the management. That is the difference, you know it. But few points which I think are very important, that first of all, when you approach the patient, then know your patient. Talk to him. Talk to the patient. What's he doing? What is his profession? All these things. Because that may give you, look at the hands and all that. And then know your audience. When you are looking at the patient, then if the relatives are allowed. And then when you have prepared your paper and you present it to the examiners, now the audience is the examiner. So level of understanding, intelligence, everything is changing. So you have to be ready for that. And know the situation. Situation is, well, the examiner, right? Supposing you have not done well in the long case. Now the situation is slightly difficult for you in the short cases. You imagine that, well, I have to perform it now. The situation has changed. But I don't want to say that if you have done a long case very good, that you just mess up with short cases. No, that's not like that. And of course, practice. You have been practicing for 3 years. Every day you are looking at patients, taking histories and all that, and putting them up in front of your consultants every day, right? So practice, don't forget it. It is the examination every day. Examination is not a great day in the life of a medical student. Always remember that. So always remember, there is a template for oral presentation, which must have these things. You know, chief complaints, history of present illness, review of systems, past medical history, very important. Past surgical history, very important, right? Patient may suddenly tell you that, well, doctor, I went for this hernia and then I became unconscious, stayed in ICU for some time. Well, it's a very relevant history. It can give you many ideas into the patient, what was happening, why it happened. It will make you wiser. And when you tell this to the examiner will immediately say, oh, he may not be a good doctor, but he's a very safe doctor. Right? So that is how you just keep on getting brownie points for yourself. People forget allergies and medications. Always remember, we are using so many drugs which have never been used, like propofol, a lipid-based, egg emulsion-based, etomidate, right? Nobody will just go to the counter and ask for propofol and etomidate, right? So these are drugs which you are going to use probably for the first time and maybe for the last time on that patient. You have to know about the allergies. Smoking, alcohol, social and work history, everything tells you about that. And then you give up to physical exams and medicine. So be organized. Put up a template for yourself and follow the same template all the times. And I always tell, this is my favorite slide for practical tips. Tell a story. And in the middle of that is your patient. So you weave a nice story. And remember, the lady medical students, they are very good in telling the stories, right? But when a male or a gents medical student tells the story, then he immediately stands out. But it has to be a truthful story, a well-organized story, right? With a beginning, middle part, and the end. And always remember, right? You start with a strong opening sentence. Sir, I'm presenting Mr. So-and-so. Always treat the patient as a person. Never treat a patient as a patient. He is still a human being. And if you do well on that, you will send him home as a human being. So always remember, start with a strong opening sentence, right? That, well, I'm presenting Mr. So-and-so, right? Or if you are telling in Hindi, sir, मैं आपको जो ये Mr. So-and-so बता रहे हैं, या श्रीमान ये बता रहे हैं, इनके बारे में मैं बता रहा हूं. See, it immediately clicks in the mind of the examiner that, well, he is humane. That is what we need. Present the patient and the illness. Never forget the patient. Present in the logical sequence, right? And all the positives and the negatives. And once you have done it, then summarize the case. People immediately sum up. After history, they immediately go to the lab investigations and other investigations, and then suddenly management. No, that is not the way. Once you have finished telling the story about the history, you sum up. You can say, sir, now I conclude as, put up the positive points, that these are important points. The examiner will suddenly, if he was talking to his colleague or writing some eating some kaju and kishmish or drinking some tea, he will immediately sit straight. Oh, this boy is making a conclusion. Very, very interesting. And then you will say that after this, my differential could be this, 4 or 5 diseases. And then I will go to all the laboratory tests and all that, so that I can prove my hypothesis of differential diagnosis. Oh, examiner suddenly becomes very happy. He may not show on the face, always remember, but he'll be very happy inside. So after differential diagnosis, you go to your investigations, and again, you sum up. Tell the gist of the history and the investigations, and ultimately, what's your differential diagnosis and which disease or which thing stands first. Improve your presentation, be enthusiastic. Use an audible way of speaking, right? That is important. We want to look in your eyes that you are enthusiastic. And try not to read your presentation, what you have written on your 3 or 4 pages in which you are writing the history of the patient. You just memorize. That's why memory is very. If you are looking in the eyes of the examiner and presenting that, it is always very good. It shows that, well, you are sincere, you are honest, you have done a hard work throughout your 3 years. That window opens, right? And at the end of the examination, you see, you may ask your mentors or the internal examiner that, sir, can we have the feedback? Yes, every examiner, they will not tell you whether you failed or passed. That comes indirectly in the evening. Somebody raises their hand. Yes, you have passed. These are our peculiar ways of telling people that you have passed. But, right, they can give you feedback and listen to that feedback. Supposing you have to stay for next 6 months, that feedback will help you out. In 6 months, oh, there's nothing like past. More tips include only the most essential facts, right? Be ready to answer any question about all aspects of your patient. That is very important. And be honest. If you have not done something, don't say you have seen. Supposing you forgot to put hands on the abdomen to palpate the liver, in the case of mitral stenosis, say, sir, I forgot. Oh, okay, no problems, man. Learn it. Your honesty will fetch you marks. Keep your presentation lively. Keep in mind the limitation of your listener. See, examiner, of course, means he's not there for fun. He has to listen all the humbug. And beware of jumping back and forth. The same way that when you are writing your paper, then just don't go out from one, that you start with the last question first. That is okay. We'll say, okay, it is going from 10, 9, 8, 7, 6, 5. No, 10, 1, 7, 8, 5, 4. Oh, horrible. After all, it is an exam. So, well, your abilities will be different, but the examination will, of course, be the same. Otherwise, people will go to the court. They say, oh, for me, the question was different. For him, the question was different. For the written exam, I'm saying, not for those exams in which batches of people come in to take multiple choice questions, because there they keep on changing. So it may be unfair for some, but always remember, examiners don't want to make it like that. So, and always remember one more thing, the examinations are really formidable, even to a person who is very knowledgeable, prepared a lot, because we have seen that. Because on that day, somehow he has not performed well. So, no problems. Come after 6 months. It's not a big deal, right? Why? Because the greatest fool can ask the nastiest question, which nobody can answer at that point of time. He may answer after 6 months, but not at that point of time. Thank you very much.